Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing home and assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. The Injured Senior Podcast is here to help. Steve Heisler is the creator of the National Injured Senior Law Center and has been advocating for seniors' rights for over 20 years. You have questions, and Steve Heisler has answers. This is the Injured Senior Podcast.
Dr. Johnny, so let's talk about COVID-19 in nursing homes and other long-term care facilities. You heard the statistic, 38% of all U.S. deaths happen in a nursing home or assisted living facility. Can you talk a little bit about why so many people in nursing homes are coming down with COVID?
Yes, of course. So again, we have to remember this is a viral and this is a respiratory viral infection. So it is spread via close contact, with respiratory droplets in close contact for prolonged exposure. And the definition there is 6 feet for longer than 15 minutes. So if you're within 6 feet of somebody for longer than 15 minutes without a mask on, your risk of acquiring this virus from the other person is pretty significant. It's not just nursing homes, it's all congregate settings where you have patients or people in close contact for prolonged periods of times. Nursing homes, as we said, prisons, meatpacking plants, cruise ships. These environments set people up for prolonged close exposure. Nursing homes, however, are unique because the population of people in nursing homes tends to be the population that is most vulnerable to disease and death from this pandemic. Okay, if you look at hospitalization rates, they skyrocket as you get older. And you look at fatality rates, they skyrocket as you get older due to this pandemic. The elderly are most vulnerable. So when you have a group of elderly people in a closed environment, you're likely to see COVID-19 spread rapidly and harm those patients.
I take it that the nursing home industry was probably felt like they were hit by a brick over the head when COVID happened, and early on, it was just kind of like just do what you can do to stop the bleeding. We're in the month 9 now. Do you think that things have stabilized and gotten a little better as far as prevention in the nursing home arena?
Well, I think we've made some inroads for sure. Certainly, we have testing available now that we can do. We can get rapid tests back within 15 minutes and be able to test our nursing home populations frequently. We hopefully, if we could educate people to wear masks outside of the nursing homes, then when they come in to visit their loved ones, their risk of them passing the virus on is less because they haven't acquired it on the outside. If you can reduce your case rate or the number of positive cases in your community, you're going to reduce the number of positive cases in your home.
Are the deaths, and I don't know how close you monitor the statistics, but are the deaths decreasing in the nursing home arena, or has it kind of stayed steady, or do you know anything about that?
Yes. So if you look at the curves for daily case rate, daily hospital, let's see. If you look at the curves for daily cases, hospitalizations, and deaths, the daily cases and the hospitalizations mirror each other. As the case rate goes up, the hospitalization rate goes up. It lags behind about a week or so. And those curves are unfortunately on their way up. I think we mentioned earlier the the number of cases in the United States were 10.6 million cases and 242,000 plus deaths. And I think we had 150,000 positive cases, new cases today. The one positive curve, if you will, are the daily death rate. Our death rate has come down with this pandemic, and that has to do with, again, early testing, early diagnosis, and we've made some inroads in treatment that has impacted survival that we didn't have back in March and April.
Right. You saw the president came down with it, and he got, and I'm gonna butcher this. Is it remdesivir or he was given the Rolls Royce of treatment options for the average Joe or Jill in the nursing home. What type of remedies or treatments are they being given?
So the one treatment that has been shown to impact survival is Decadron or dexamethasone, and that was in a trial called the recovery trial out of the United Kingdom. And essentially, once patients with COVID-19, once they develop hypoxia, meaning their oxygen saturation falls below a certain level, namely 94%, if you administer Decadron, that you will reduce the mortality rate by 18%. And if they get on a ventilator, you reduce the mortality rate by upwards of 30%. So Decadron is the one medication, the one intervention that has been shown to impact survival the most. What you're referring to there is, what you referred to, Steve, was the remdesivir, which is an antiviral, and that is what the president got. And what remdesivir does is it acts upon the virus and kills the virus. It hasn't been shown to improve survival. What it's been shown to improve is time to recovery. So it has been shown to reduce the duration of the illness, with a trend towards a possible survival benefit, but the study that did not clearly define that.
So the protocol is, what did they start with? If someone is afflicted with COVID, is the protocol to start them on the
dexamethasone?
Dexamethasone, right.
So the protocol, if somebody is diagnosed with COVID-19, the protocol is basically supportive care. You treat it like any other viral infection. Fluids, Tylenol, bed rest, that sort of thing, supportive care. If a patient develops hypoxia, meaning their saturation drops below 90%, at that time, patients should go to the hospital and be evaluated, because the treatments are then indicated, namely the dexamethasone and remdesivir.
Oh, so anyone that presents to a hospital with a sat rate under 90% is going to be given one of those two medications?
Actually, it's under 94% of what the guidelines say. So saturation rate less than 94%, dexamethasone, and possibly remdesivir.
Great. All right, I've got the question of the show for you, Dr. Johnny. I know you've probably been waiting for this question. How close are we to a vaccine? And if you watch the news or you read the paper, you just hear so many conflicting things. I know you're not Dr. Fauci, but I'm just wondering if you have any insights as to when we can expect to see a vaccine and hopefully get back to some sense of normalcy.
Yes, well, the last I heard from Dr. Fauci a week or so ago is that we could expect the vaccine data to come out by early to mid-December. And Pfizer, I believe, has come out with some preliminary data showing 90% efficacy with their vaccine. From what my reading has told me is that we could expect distribution of the vaccine probably after the first of the year. The vaccine, from what I understand, is going to be a 2-part administration separated by a few weeks or a month. And if 90% efficacy pans out to be true, we could get this virus behind us, hopefully by the end of next year.
Boy, from your lips to God's ears, Dr. Johnny.
Right.
Will the aging population, the seniors and elders, will they be the first to get the vaccination, or you have any idea about that?
From what I understand, they are prioritized to be the first ones to get the vaccine because, again, they're the most vulnerable.
Got it. Dr. Johnny, again, thanks for the information that you provided today. Very thought-provoking and really answered a lot of questions about COVID-19. I want to thank you for hitting the trifecta, which means you've been on this show 3 times. That's more prestigious than appearing on Saturday Night Live 3 times. So Alec Baldwin and Tom Hanks, they have nothing on you, Dr. Johnny. So I want to thank you for coming on and really shedding some light on this whole COVID situation. Now, if somebody wants to follow you or maybe get in touch with you, is there any social media that you have where they could find you on?
I'm on LinkedIn.
Okay, so they can find you on LinkedIn?
John Cascone, MD.
John Cascone, Cascone, MD.
Yes, sir.
Thanks again, Dr. Johnny. We're going to have you back again because we're going to have to talk about, I think we discussed earlier, Legionnaire's disease or urinary tract infection. So you are an encyclopedia for our listeners about infectious diseases. So thanks again, and we'll be talking to you soon, my good friend.
Thank you. Now, have a good day and stay well.
Injured senior and aging population community. Thanks for listening to today's episode. I want to again thank Dr. Johnny Cascone for appearing on today's show. Really, really good stuff about COVID-19. And I'm sure we can all breathe a sigh of relief when we hear that we might be rid of this, hopefully by the end of next year. So that's good news. If you love the Injured Senior podcast, we'd love for you to subscribe, rate, and give a review on iTunes. If you want to share your story on an upcoming show or have any suggestions or comments about the show that you want to talk to me about or share with me, please email me at Steve, Steve, at injuredseniorhotline.com. As you know, I answer all emails, so have at it. I'm looking forward to reading them. So until next time, I am so looking forward to next week's show. Stay safe, and I will talk to you then. Bye-bye, everybody.
Thanks for listening to the Injured Senior Podcast with Steve H. Heisler. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. To find out more or to get help anytime, go to injuredseniorhotline.com or call 855-622-6530. We'll see you next time.